So the APHINITY trial was a trial in HER2-positive patients in the adjuvant or early stage setting, and so it was really a platform of Herceptin and now adding the consideration of pertuzumab, which is another monoclonal antibody targeted against HER2. And I think specifically for pertuzumab, in terms of it inhibits the dimerization of HER2, HER3. HER3 has signaling in terms of through the resistance pathways. And so the trial design was either an anthracycline taxane-based regimen for node-positive patients. They also had a cohort that they limited for node-negative, and they received their chemotherapy with Herceptin-based, and then a group received pertuzumab in conjunction with their HER2-targeted therapy of Herceptin. And so they followed these patients, administered it for a year, and then followed the patients. It was a blinded trial, and we've been waiting because the HER2-positive patients are doing so well with just HER2 therapy. I think that's made the most dramatic improvement. And so all of us, I think, that participated in the trial and have seen the stunning effects of pertuzumab in the metastatic setting, where it improved outcomes and median overall survival for the metastatic first-line patients by 6 months, and then it did confer an overall survival advantage in our metastatic patients. And so this was a trial now taking pertuzumab in the adjuvant setting, and so there's been a lot of excitement and enthusiasm just from what we've seen as a paradigm shift in the metastatic setting, as that's our go-to first-line regimen that has a survival advantage for the metastatic patients. And so now what we've seen as the APHINITY data has rolled out, I think not as dramatic as a benefit in the Cleopatra trial, just because these are early stage patients and they're doing better from the get-go across the board in adjuvant trials. But pertuzumab there also added an improvement for these HER2 targeted therapies in terms of adding it to Herceptin-based therapy. And so I think the question is, the magnitude of benefit certainly was smaller because these patients are doing better already with their adjuvant chemotherapy and Herceptin. Can we look at subgroups of patients that received it?